So I passed yesterday, and I just want to tell you, I swear half of the questions were from your class.
Oh, yes. I mean,
Half of the questions. I was amazed.
yes. Do you mind if I ask you what was your score on your diagnostic test?
Most of the time, let's see, my last ones were like 92. I got an 89, 96, 92.
Yeah, there is no possible way that you would not pass. Anyone that scores more than 80 the first time is almost a 99.9% chance of passing. So how I recommend everybody to do it is imagine that your board day is today. So today would be the day for you to take your diagnostic test, like if you are sitting for the board, because then you are able to find out those mistakes. Now, in reality, your board date should be 2 weeks ahead. Now you have 2 weeks to kind of like, oh yeah, I never noticed this. I was making those mistakes. So a lot of people have mentioned our diagnostic test is a closed simulation of the real test, and I have seen that over and over again. So what kind of things do you think helped you the most in your preparation?
I think the diagnostic test helped a lot. I think just even listening to your modules, listening to them,
Mm-hmm.
going to Cahoots even helped a lot.
Mm-hmm.
The modules, just listening to them, even the lives, even the dump sheets, listening to the dump sheets, that helped a lot. Just rehearsing and looking at the PDFs and looking at your testing strategies, that helped a lot. It helped my critical thinking. Other questions that they asked, it helped that.
Okay. So, there is no magic bullet, right? So it seems
No,
like you did a lot, you study.
yes,
But I think one thing that's for sure that helps a lot of people is that when you print your PDF, let's say you finish module one, now you're going on module two. Let's say the next one is module three, which is today. Before you go to module three, you have to take your time and pull it back a little bit and review again your
right,
modules one and two. And then as you move to module four, you pull it back and you review the PDF, not the videos. The videos will take longer. But
right,
then again, now you're just going by the topic and say, okay, this is the cerebrum. What are the four lobes that we need to remember of? And kind of like going by almost as if you are teaching, because if you
right,
do that way, you develop confidence and you know the stuff because you're not looking, you're just looking at the topic. If you talk about lithium, what are the things you remember about lithium? What are the contraindications? What are the patient's educations information that's important? Things like that really kind of really push you along the way. How long was your preparation, by the way?
well, see, the first test I failed,
Okay.
so it was probably 75 days.
Okay. So that's very important. And thank you for reminding us of that. What was different the second time you take the test?
um I was prepared. um
How was the first time that you were not prepared?
I I had taken the Georgette, and
Okay.
it did not prepare me at all. And I even reviewed the purple book,
Okay.
and I think I was doing memory, and memory did not help me. I needed to know why,
Mm-hmm.
what, and I swear this helped me more than my program. I
Yes.
It
I
did.
mean, this is not uncommon, and I couldn't be happier to hear that. But this is something that we hear all the time, that the 2 months that you guys spend with me, I put no limitations, right? So some people can
Right.
stay with me for a year if all you, I don't care, guys. I really don't. At the end, I really want you to achieve the results that Lauri achieved. But also feel empowered that once you pass the board, you really, hey, I can take care of patients.
Right.
It's not just that like, oh, I just went to school and now I'm here. Our preparation is really heavy. I know I ask a lot, but the results really come through.
I
You
know
know,
I'm a strong, I'm a nurse practitioner already, but I know I'm a stronger PMHNP provider now because I
good.
know what the pathways I'm going to be using and what to look for, and I'm going to be a better educator with my patients.
Yeah, and if you really take the time, the next step is a little bit more challenging, which is the psychopharm. If you
Right,
really take the time for eight weeks to really study the medications, you don't need to know all the medications, but it's
right,
maybe a handful of, I don't know, 50 plus. And that's all you need for your toolbox. And knowing each one of them intimately, like you are able to mix one with another and know which receptors you are looking for, at least in theory, and then you adjust in practice depending on the patient, you will really, really be super strong,
right.
you know.
So how do I get to the pharmacology? Do you have that somewhere?
Yes, it's on our main website.
Okay,
You can go to
okay,
www.mpexamcoach.com and you
okay,
go to courses, and then you should see the website, the course, the Psychopharm. Is
okay,
not a watered down course. This is top notch, very deductible, very school oriented course, right? So
okay,
it's not a piece of cake. But if you spend 8 weeks there, you get the course for a full year. You
okay.
get at least 10 times more value only on the PDFs that I'm putting over there because you have some great PDFs. One of them is a tree. Let's say you have just like cardiac arrest. We have a tree. Okay, first you do compression, then you do this medication, then you do this medication, and you stop. So there is
Mhm.
one PDF in there that is a tree for psychiatry. If you have bipolar, try this condition. Did they improve or not? Try this condition. What is the result? Is amazing. I
Okay.
don't want to say that's from Harvard. I don't know if it's Harvard or Yale or Brown University. Oh, I can't remember, but it's wonderful. I mean, I sometimes I just go back and be like, yeah, I forgot about this.
Mhm.
I mean, it's good stuff. And you get a lot of value, 10 times as much value only on the PDFs that I have in the course there. So I definitely recommend it. Just
Well,
to,
I'm going to recommend you to all the people that I know that are going to school, or
yeah,
I
thank you.
appreciate your program and it has helped me tremendously. And I just wanted to tell you that and tell everybody to do the work because it's there.
Yes, thank you. I really, really appreciate it. That means a lot from you that had a not a positive outcome the first time you tested,
Right.
but you didn't give up, and you really kept at it, and you took about 75 days to
Yeah.
really go through this stuff.
You
Thank you,
have to
Lauren. I
do the
appreciate
work.
it for coming here today and giving a heads up for everybody else. So that's a
And
great way to start today's event.
somebody wanted to know where the dump sheet is, and it's on YouTube. So,
Yeah, just search NP exam coach dumping sheet,
yeah.
and
But
then you find it. But the
thank you so
dumping
much.
sheet too, you need to practice at least 10 days before your test date. I mean, 10 days may be too many,
Yeah.
but because it's a lot, and you gotta be
I
able
tried to
to.
do the dump sheet and I did some of it, but it kind of thought it made me nervous. But I
Mhm.
would do the dump sheet in between. But when I was doing the questions, they were so, it seemed easy. I did not easy, but they were similar to what I have been taught.
Yeah, I mean, I'm glad that the program served you well. So thank you for stopping by today. I
Okay.
really
Thank you.
appreciate it.
Have a
I
good
All
would
right,
night.
good to see you.
interrupt.
All
Bye-bye.
right, Everybody, we're about to get started, right? And today,
To interrupt, but what's the dump sheet? She said
I'm
something about a
sorry.
dump. I caught the end of the conversation, and I don't mean to interrupt, but what is the dump sheet that she was talking about?
So the dumping sheet is a method that I teach. Throughout the course, there are several things you need to know, like some acronyms, but there are too many, right? So acronyms for medications that cause depression, acronym for medication that cause mania, acronyms for medication that are inhibitor or inducers. So I would pick up few of them. I would pick up, for example, Erickson stage of development, and I would put them in a dumping sheet. What is a dumping sheet? When you sit down, from the moment you sit down, you have 18 minutes to test. Well, you can read every paragraph, every statement there, or you can do your dumping sheet because you're not cheating. You're sitting down. The time is allowed to you. They'll give you a piece of paper, and then you can put your acronyms to help you when there's questions at 170, you're tired, you don't get confused which stage of Erickson development they're talking about because you got your acronym there. You can look at it real quick, boom, clarity, right? You got the instant light. So the dumping sheet is very powerful, but it only works if you do it ahead of time. Now, can I do a dumping sheet for you? The answer is really no, because it's an individual process. What is hard for you to remember? I did a generic one, which has a lot in it, but I wouldn't recommend putting all that. I just put it like a broad, hey, this is a dumping sheet. These are things that may be helpful to you during the test. Did they answer your question?
Yes, it did. Thank you.
Yeah, so just search it, NP exam coach dumping sheet video, and then you should be able to, Google should be able to find and then send you the link. So
Thank you.
I have a question. Sorry, I know we're about to get started.
yes, kindly, if the question, go ahead, ask your question, please.
So I'm now kind of really trying to, hone in on everything. Since I'm done with school. I did a practice test today from the question bank, but I'm confused because I did the first one. I was trying to just do module 1, so I wanted to go to module 1 questions.
Yes.
It was asking me stuff from module 2 as well. Like I had 147 questions. How many questions are in each module?
So each one of them are different. Each one, I don't know how many questions. I think there are 147 for module 1.
Okay.
There are more, maybe like 180 for module 2. I don't remember.
Okay.
But
So they're just gonna
total,
be mixed. It's gonna be mixed up because I felt like I was going over material ahead, and I'm like, I didn't.
Yeah, I mean, might be a few things here and there, but 80% should be reflecting the module. But
Okay.
yes, it's just really hard to talk about lithium here and then on module, 5 we talk about lithium again for whatever reason.
Okay.
Might be questions related to that, but for sure, 80% should feel the same. Okay.
Okay.
Jacqueline, that's the last question. We can get started, guys, because at the end of today's event, what I would do is stay back, and any question that is related to the course, where is the PDF located, what is the question bank, how do I log in?
The App Store, Guru. Open it. It will optimize your inbox by unsubscribing you from all those annoying pages.
Yeah, I think you have your mic on, Jacqueline. So let's go ahead and get started. So I know some of you guys like Gemini to transcribe. I trust that it sends it to you immediately. So it is transcribed. I just noticed. So why do I always show the domains? The domains is what we teach first, right? Domains 1 through 5. So, and what is important here is how many questions are in each. So the first domain, scientific foundations, you will find 33 questions on a test. The second one was last week, is the most important one, is advanced practice skills. I'll bet you lots of questions will come from MMSC, right? Or MSC. Now, it's kind of easier here because it's not long. It's about what, 13 small videos that we do or so. Now, the third most important one is diagnostic and treatment. Okay, so right here, 33 with 33 is 66 plus 40. So we got about just roughly over 100 questions, right? So 107, just roughly. How many questions do you need to pass the board?
105.
Right. So if you were to master really good, please don't do this because it'll be crazy, right? But if you were to master really good, there is a high possibility that here alone, you would be at that 100 questions, just about passing, right? So 100 questions is 107, right? So it could be that here alone, it is the bulk of your passing grade. Why am I talking about this? Well, this here, the module 4, is where most people have trouble. And I was talking to, what's her name? Oh my God. I was talking to Flavia yesterday. She just passed the board. It's like, Dr. Lopes, I'm freaking out. I don't understand the family therapies. And she's about to test, right? Not a good time to be freaking out. I said, hey, don't worry about it. At this point, write down 3 things for each. Spend no more than 10 minutes looking at it. And now is not the time. What do you mean? Well, it will only be 17 questions. Sure, you want those 17 questions, but this is not where your energy needs to be focused. Then we have ethics, legal principle, and culture, right? 26 questions. And these is easy. These are easy if you took a course like ours. Our course, we break them down how to answer questions. They are not hard questions, but you need to know how to answer them, right? Or they can be very hard, specifically for nurse practitioners that think very critically. And, you know, they'll be like, okay, let me collect labs when the answer was, how do you feel? How is it done in your country? All right. So, but right here, the first module, 1, 2, and 3, first 3 modules, in module 5, it is where your energy needs to be. Do not neglect module 4. However, it is priorities is not in your top 3 priorities or 4th priorities. Is on the 5th place. Okay, so hopefully this brings a little bit of awareness where the test questions will come from and guide you a little bit more to, you know, to help people like, okay, if I don't get to therapies very strong, I don't have to freak out because I really took the time to understand modules 1, 2, and 3 and module 5. Okay, so we're about to get started. So today it is a long event. We'll cover lots of things from our module 3. As we mentioned, 33 questions, diagnostics and treatment. If you have a question, please ask. Now, I ask you to save course questions, where the diagnostic test or where's the question bank for the end, so that way I can show you where they are located. And then we can discuss anything that is important to you. But for now, all focus, all eyes on this module. And before we go on, I have one more thing. As soon as you finish module 3, you should be jumping on question banks number 3. Because if we learn it, or at least we reviewed this content again, because you should have done once, or you will do once alone, right? You should be able to apply the concept or as much as possible. And if you can't, it's great, because then you can find where your weaknesses are. Okay, So if you ask me what a good preparation would look like, I think, Mary, I'll show you where the question bank at the end, okay? If you ask how much time it takes a good preparation, really there is no magic number. But if you devote 1 week per module, so modules 1, 2, 3, 4, 5, and 6, now you have module 7 is the test, module 8 is another test. So right there you have 8 weeks. And then you should be aiming to test immediately after that, right? But it's going to take a little bit of work, right? It's going to take a little bit of work from your part. Okay, so always going forward, stopping, looking at the PDF of the modules that you previously covered. Okay, so we'll be covering lots of content today, right? So here we are. This is our roadmap. This is pretty much all the content we'll be covering today. Lots of things to learn and discuss, right? Starting with what is tolerance, right? Do not blow away the easy concepts. Anytime you see anything that you remember from nursing school, I guarantee you will be on your board. Because if it wasn't in your nursing school, and it was again on your master's or doctor's degree, it is important that you know. And what is tolerance? You have seen this since probably high school, maybe, for some of you guys, right? So tolerance is nothing but needing more of a substance to achieve the same results, right? Now, tolerance can be in relation to an SSRI. You know, the patient's been okay for a year on 50 of Zoloft. Now, it's okay, but getting a little bit more antsy, a little bit more depressed, maybe now it's time to jump up. Most likely it would be a lot earlier than that, but I'm just giving you an example of tolerance. Most commonly, tolerance is related to drugs, right? Basically needing more of a drug to achieve the same results. Occurs when the body becomes accustomed to the medication or alcohol or illicit substance, requiring either a higher dose for the same effort or switching to a different medication altogether. So what you need to write it down is what is tolerance, what is dependency, what is abuse, because these are all close terminologies. Okay? So we'll cover some of this. Now, when it comes to alcohol, go ahead, Deborah. You have to unmute yourself if you're trying to speak. Deborah, we cannot hear you.
So Dr. Lopez, that was a mistake.
Okay, no problem, my dear.
Yeah, I didn't want to speak. That was a mistake.
Can
I'm
you
sorry.
guys still hear me or no? Nope, never mind.
Dr. Lopez, you're frozen.
Okay, so I'm sorry. I think I'm not sure exactly what happened there. I got kicked out. So here we go. All right, we're back. So what is kindling? Think of this way. Kindling, it is nothing but our nervous system that lowers the threshold, provoking a seizure, right? Or anything that lowers the threshold for a seizure. Think of this way. When I was younger, much younger, much younger, I used to jump from helicopters, not helicopters, airplanes, right? On missions and things. So the goal is for you to jump and get to the ground as soon as possible. So the first time I was just like, okay, if this guy can do it, I can do it. Not worried about at all. But as soon as my body hit the ground, the second time I was worried because it hurts. It hurts, right? So kindling, it's like your nervous system's remembering what has happened before. Now, what is important is this memory of what happened before. Now you are more likely to feel damage, remains imprinted within our nervous system. Another way you can think of this is if you have taken out the board and you didn't pass first time. Now you're very nervous. And then now your nervous system activates you. And this is why it's so important that if you have come to our course and because you fell in another course, do not jump into a set date. I have to test by September 29th. No, you test when you feel you're ready. Because the least we want to do, we want to over prepare so that you don't feel nervous on a test day. You should feel relieved that you don't have to prepare anymore. That is the goal. So kindling, what are the medications that you think would cause kindling event?
Benzo?
Benzos, okay. Well,
Buprenorphine,
say it again.
Wellbutrin.
Sure, Wellbutrin, more than benzos. But how about the most popular one?
Duloxetine.
Not necessarily, but it could in rare events, but it's not what I'm looking for. What causes seizures the most? Alcohol. Mary said alcohol, right? So this is why it's so important when someone is going through alcohol withdrawal to use our C-word scale, because alcohol withdrawal can kill. Not the same for opioids withdrawal, which will be nasty, but it does not necessarily kill, right? So subsequently, withdrawals or damage worsen as the nervous system really recalls what has been sensitized or damaged prior to the withdrawal. So now, when you hear kindling, immediately you think lowering the seizure threshold. Okay, so now someone mentioned Wellbutrin, very true. Someone mentioned alcohol, super true. And now let's say you have someone that I see this mistakes and drives me nuts. Please, everyone, make sure you have your mics off, closed. Is someone's going through a withdrawal, Wellbutrin, or even taking a stimulant? That is the perfect storm for a kindling event. Anytime you hear kindling, you think lowering the seizure threshold. Okay? So remember, easy concepts comes with hard questions. So now you understand what is tolerance. How about addiction, right? What is addiction? Addiction is a chronic relapse condition that despite of whatever, the person has this compulsive desire to have what they are addicted to, right? Let's say my marriage is over, yet I'm not stopping drinking. It was over because I drink every night and I haven't been a good father or a good husband or have been abusive, spouse. Hey, I'm not, I'm just saying. Now that is considered addiction, that because of all the consequences that has happened in my life, I am still not stopping, right? So then we say, what is dependency then? Remember, it's very likely that you get a question that has addiction, tolerance, dependence, and abuse. So we covered tolerance. We cover addiction, which is nothing but a compulsive drug seeking despite of losing the job, losing my spouse, losing my family, right? I'm still going to seek that drug. So that is an addiction. And addiction can be cocaine, sex addiction, pornography, opioids, tobacco, alcohol, right? These all things that can be addiction. Now, can someone describe to me how is addiction different than dependency? Go ahead, please, Sherry.
With dependency, the body needs the medication, and if the body does not get that particular medication, they will go through some type of illness or withdrawal symptom.
Wonderful, absolutely perfect answer, right? So you need to know what's tolerance, and you need to know what is addiction, and you need to know what is dependency, right? So when it comes to potency, we can put in a scale: high potency and low potency. A high potency describes a drug that is low milligrams but does a big job. For example, Haldol, we don't give it, a super high dose of Haldol. It's a small milligrams, right, to achieve the result. Now, comparing to chlorpromazine, it requires a much larger dose. So when you hear potency, just remember the dose. That's all you need to know. The dose of a high potency is one that's very small, but it does a big job. Compared to low potency, you need more of the substance in milligrams to achieve the result. Okay?
Can you explain with efficacy?
What do you mean by efficacy?
I was looking up lithium, and I did it was like pharmacodynamics, and like they, you start describing potency with, I think, efficacy, if I'm not mistaken.
No, I think the what you trying to bring it up is that a narrow window for lithium, right? We only have between 0.6 to 1.
Oh, no, it wasn't that. It was I was looking up, they talked about, like, it was pharmacodynamics, and it was talking about like drugs, and it talked about like the amount of drug to reach the effect, and it was potency versus, I thought it was the effect. There's a name for it. And so like I needed an example, but I couldn't figure it. It didn't have one. So like Dilaudid and morphine, I don't always understand potency when it comes to two drugs comparing.
Yeah, basically, good one. Dilaudid and morphine, right? They both opioids. But here we're talking about high potency. Dilaudid, you need much lower dose than morphine, which would be a low potency drug. We'll cover more of that module 1 at the end, so we can get going. But please save your question and let's discuss that at the end. Okay? Who would be so kind to read this question? Any volunteer? Mary, please.
A patient has been diagnosed with panic disorder and agoraphobia. He is prescribed Paxil CR 37.5 milligrams daily and clonazepam 0.5 milligrams daily as needed. The patient has been taking clonazepam for 3 years and currently takes 4 pills to achieve the desired effect compared to when he first started taking the medication. Which of the following processes best describes this patient's scenario? And I'm going to say C, tolerance.
Yeah, absolutely. Great job. Just you know, as you look at this here, tolerance, kindling, lowering the seizure threshold, addiction will compulsively seek the drug despite of the consequence, tolerance needing more of the same substance to achieve the same result, and potency we give Haldol versus the other medication to describe potency. High potency, small milligrams or smaller milligrams. Low potency, you need a lot more to achieve similar results. Okay, so that is simple concept. We stopped recording because we have already recorded, and everything is recorded. And of course, you can always go back and go, you know, and see this recording here. Let me see if stop recording.
Get the full 30-day walk to success PMHNP review course https://npexamcoach.com/live-pmhnp-review-course/ref/NYMER/use code MD150 for $150 off. Limited time offer.